We're going to talk about 5 medical tests that doctors routinely recommend for older adults. Tests that sound responsible, that feel like the right thing to do. But that, in many cases, may actually do more harm than good. Now, I know that sounds controversial, and I'm not here to tell you to ignore your doctor or skip important care. But what I am here to do is give you the information you need to ask better questions, make informed decisions, and protect yourself from unnecessary procedures that could hurt your quality of life. Because here's the truth, after 70, the rules change. What makes sense at 50 can be dangerous at 75. And yet, so many doctors apply the same testing protocols across the board without considering your age, your overall health, or what truly matters to you at this stage of life. Before we dive in, do me a favor, drop a comment and let me know where you're watching from. Are you over 70 yourself, or are you caring for someone who is? I'd love to know who's here with me today, and if this conversation resonates with you, please hit that subscribe button so we can keep having these important talks. All right, let's get into it. Here's something most doctors won't tell you outright. Medical testing after 70 requires a completely different way of thinking. When you're younger, finding a problem early often means you can treat it and live decades longer. But after 70, many conditions progress so slowly that aggressive treatment can steal your comfort, your independence, and your dignity without adding a single meaningful year to your life. Think about it this way. If you're 75 and a test finds a slow-growing cancer that would take 15 years to cause problems, but the treatment leaves you incontinent and exhausted, was that test really helping you, or was it just creating suffering where there didn't need to be any? That's the question we need to ask more often, and that's what we're going to explore today. Test 1, PSA screening for prostate cancer after 75. Let's start with one of the most common and most controversial tests for older men, the PSA test for prostate cancer. Now, here's what you need to know. The U.S. Preventive Services Task Force, the gold standard in medical guidelines, explicitly recommends against PSA screening for men over 70. Not because prostate cancer isn't real, but because the harms of screening often outweigh the benefits. Here's why. Most prostate cancers in men over 70 grow incredibly slowly. So slowly, in fact, that you're far more likely to die with prostate cancer than from it. You might live another 10 or 15 years and never have a single symptom. But once that PSA comes back elevated, the cascade begins. You get a biopsy, which can cause infection, bleeding, and pain. Then, if cancer is found, you're pushed towards surgery or radiation. And those treatments? They come with permanent side effects: incontinence, erectile dysfunction, fatigue. All to treat something that probably never would have bothered you in the first place. A major study followed over 76,000 men and found that PSA screening in men over 70 showed zero improvement in survival but caused significant harm through unnecessary treatment. So before you agree to that test, ask your doctor, given my age and overall health, what's my realistic life expectancy? Am I more likely to die with this cancer or from it? And what are the real risks of the biopsy and treatment you're recommending? Test 2, routine colonoscopy after 75. Next up, colonoscopy. Now, don't get me wrong, colonoscopy is a life-saving test for colon cancer screening in younger adults. But after 75, especially if you've had normal colonoscopies in the past, the risks start to outweigh the benefits. Here's the reality. Colonoscopy in elderly patients carries significantly higher risks. We're talking about perforation, a tear in the colon, severe bleeding, and complications from anesthesia. In patients over 75, the complication rate is 3 to 4 times higher than in younger people. And here's the kicker. If you've already had a few normal colonoscopies, your chance of developing treatable colon cancer that would actually shorten your life is extremely low. The American College of Physicians recommends against routine screening colonoscopy in adults over 75 with average risk who've had previous normal tests. So if your doctor is pushing for another one, ask, what's my actual risk of developing colon cancer that would affect my lifespan? What are the complication risks at my age? Are there less invasive options, like a stool test, that we could try first? Test 3, routine mammography screening after 75. For the women watching, or those of you with wives, mothers, or sisters, this one's important. Mammography is incredibly valuable for detecting breast cancer early in younger women, but after 75, the picture changes. A study published in JAMA Internal Medicine found that mammograms in women over 75 detected many cancers, but treating them didn't improve survival. Instead, it led to surgeries, radiation, and chemotherapy that significantly reduced quality of life without adding years. Why? Because many breast cancers in very elderly women grow so slowly that they would never cause problems during the remaining lifespan. But once they're found, the medical system feels compelled to treat them, even when treatment causes more harm than the cancer ever would. The anxiety of a positive result, the pain of biopsies, the exhaustion from treatment, all of that suffering for no survival benefit. So ask your doctor, what's my realistic life expectancy considering my overall health? If a slow-growing cancer is found, would treating it actually extend my life or just reduce my quality of life? Test 4. Aggressive diabetes screening and tight glucose control. Here's one that surprises a lot of people. Overly aggressive diabetes management in frail elderly patients. Now, managing diabetes is important, but here's the problem. Many doctors push for extremely tight blood sugar control and A1C under 7 inches elderly patients, even when it's not appropriate. Why is that harmful? Because tight glucose control increases the risk of dangerous hypoglycemia, low blood sugar episodes that cause confusion, falls, hospitalization, and even death. Multiple studies have shown that aggressive glucose lowering in elderly patients actually increases mortality rather than decreasing it. The American Diabetes Association now recommends more relaxed glucose targets for elderly patients with limited life expectancy. An A1C of 7.5 to 8.5 is often appropriate. So, if your doctor is pushing for tighter control, ask, given my age and overall health, what glucose target is appropriate for me specifically? What are the risks of hypoglycemia with tight control? Would a more relaxed target actually be safer? Test 5. Routine cancer screening with CT scans and extensive imaging. Finally, let's talk about routine CT scans, PET scans, and other extensive imaging that some doctors order just to check for cancer. These tests expose you to significant radiation, and almost always they find something, some little abnormality that triggers more testing, more biopsies, more worry. The problem? Many of these findings are clinically insignificant. They're abnormalities that would never cause problems during your remaining lifespan. But once they're found, the cascade begins. A study found that incidental findings from imaging in elderly patients led to complications from follow-up procedures in 23% of cases, with zero improvement in survival. Ask your doctor, what specific symptom or concern makes this scan necessary? What's the likelihood that any finding would actually change my treatment or extend my life? And what's the risk of finding things that lead to harmful interventions? Let me tell you about a patient I saw a few years ago. He was 78, active, living independently. His doctor ordered a routine PSA test. It came back slightly elevated, so they did a biopsy. The biopsy caused a severe infection that landed him in the hospital. The biopsy found a slow-growing prostate cancer. His urologist recommended immediate surgery. When he came to see me, I calculated his life expectancy about 8 to 10 years based on his overall health. That cancer he had? It would take 15 to 20 years to cause any problems. If he had the surgery, he faced guaranteed incontinence and erectile dysfunction for the rest of his life. If he did nothing, he would almost certainly die of something else before the cancer ever bothered him. He chose to do nothing, just monitor it. 5 years later, he's 83, living fully, and the cancer hasn't progressed. Had he followed the original recommendation, he would have spent his last years suffering for no benefit. Here are 3 questions to ask your doctor before agreeing to any test after age 70. 1. What's my realistic life expectancy based on my overall health? If it's less than 10 years, most cancer screenings aren't appropriate. 2. If this test finds something, what would the treatment involve, and what are its risks? If the treatment risks are high, the test may not be worth it. 3. What does the medical evidence show about this test for people my age with my health status?